The following video will show you two different interactions between a nurse practitioner and a client. Please pay close attention to the differences between the two interactions, as at the end of the video you will have to determine which nurse practitioner performed out of her scope of work and in what way that she has done so.
This interaction takes place in a clinic as nurse practitioners can work as sole independent practitioners. The clinic setting is great for nurse practitioners because they can diagnose, order tests, and treat patients in a short period of time in comparison to hospitals. Roles in the scene are played by Cheryl as the nurse practitioner, Luca as the patient, and Aryan as the family member.
What's your name?
Luca.
How are you today? How are you feeling?
I'm doing alright.
Are you here today for some type of pain?
Yeah, I've been getting headaches recently.
Can you describe the type of headache?
There's just been a lot of pressure in my head, in the front of my head. I can't really sleep, and I've been taking work off, so yeah.
Oh, sounds painful. On a scale from 1 to 10, how do you feel?
Like around 9, 10, probably.
Has there been any changes in your diet, schedule, anything?
I've been working long hours recently, taking overnights, and I haven't been really sleeping or eating right, so.
Well, symptoms for migraines can vary for each and every individual. It could be a change in diet, lack of sleep, as you said, or it could possibly be a new medication. What medications are you currently taking for this headache?
So far, nothing really. I've been trying home remedies, but nothing's been working.
Okay, well, I'm going to prescribe to you Tylenol, which is a painkiller, which will help out with your headache.
Okay, do you know how many I should take a day?
You should be taking 2 a day.
Okay.
Alright, so here's your prescription.
Okay.
Have a good day.
Okay, thank you so
I
much.
hope your headache gets better.
Okay.
Roles in this scene are played by Gurdeep as the nurse practitioner, Aryan as the patient, Cheryl as the family member.
What brings you here?
I've just been having headaches recently. Yeah,
Okay, so on a scale of 1 to 10, how bad your headaches are?
I'd say 9 to 10.
Oh, that's pretty painful. So has there any been changes in your daily schedule or routine?
Yes, I've been working mainly night shifts lately.
Okay, so the symptoms can vary from migraines individual to individual. It could be change in diet, lack of sleep, or new medication. So what are you currently taking for the headaches?
Tylenol,
And how many are you taking a day?
2 a day.
And you don't think these are helping at all?
They're not very effective, no.
Okay, so what I can do, I can prescribe you a stronger medication than Tylenol.
Alright,
But I'll say don't take more than 3 a day. So I'm prescribing morphine.
okay.
So I hope it will it'll help, and if it doesn't, you can just come back and see me. Okay?
Alright, thank you.
Thank you.
Who was the practitioner that went out of her scope? Nurse practitioner A or B? The answer is nurse practitioner B.
Why? Nurse B prescribed medication that was out of her scope. In this case, it was morphine. Instead of prescribing morphine, she could have prescribed Tylenol 3, which is a stronger painkiller but is still in her scope of practice.
Nurse A is a good example of how a nurse practitioner and a client should interact, as she stayed within her scope of practice by prescribing Tylenol instead of morphine.